take vacation this time when you're contact
Try to keep it brief, but I think you all have the study. I appreciate Virginia Institute of Public Policy's interest in this subject and having us here because Virginians should be very concerned about what's happening in Washington. And a lot of times you hear about the impacts of these proposals, and it's about the federal budget, which you may hear more about. And we forget a couple of things. One, that the taxpayers of Virginia are those who are paying the bill. So if there's a proposal that goes through Washington that the CBO says costs $1 trillion, or upwards to $2 trillion, then we're all going to be paying for it. There's also going to be impacts on the state budget, which you're starting to hear some of the governors talk about, and those include higher costs for all of our health insurance programs, including those at the state level. Some of them are concerned, and they should be, that some of the costs from Washington will be pushed down to the states because there is no plan to pay for them. But understand, Virginia taxpayer is going to be paying one way or another. The third issue that doesn't get talked about, and we talked about in the study, is that if government subsidies for health care go up, everyone's health care costs are going to go up. So it's going to hit you in your federal tax dollars, your state tax dollars, and through your insurance plans. The study that we created really was to create an economic lens through which to review all of the health care proposals that are going through Washington. It's not a policy proposal, it's an economic proposal, an economic study, and like I said, it creates a lens. You will not probably be surprised to hear that we determined that none of the proposals that are from the majority that are going through Washington right now address the primary driver of healthcare costs in this country, and it's what we call the healthcare expenditure wedge. The healthcare expenditure, just a quick economics lesson, a wedge is anything that gets between a consumer and a producer. A tax wedge makes the price that a producer gets for something different than the price a consumer pays. The larger that wedge, the more disconnected a consumer and a producer are, the more efficiencies there are in the market. In healthcare, the wedge between doctor and patient is large and growing. The healthcare expenditure wedge is so large in this country that a patient has no idea what it costs to provide a service. I always compare it to the technology gadget market. How many people know what an iPod or an iPhone or a flat screen TV costs? How do you know how much it went down since 2 months ago, right? We actually understand intuitively what this wedge, this expenditure wedge is, even if we're not economics students. If I ask you how much it costs for the latest procedure that you had in healthcare, and hopefully you haven't had any, but you don't know. I can't imagine that you do, and that's the wedge. All right.
I do.
All right.
I'll tell you why. I was in an emergency room with a friend in Chicago yesterday, Loyola Hospital, and they had actually posted all these prices. Room prices, all kinds of procedures. I've never seen it before. And I was with a doctor friend of mine, and he was taking pictures. He said he'd never seen anything like this ever. So you're absolutely right. I was stunned when I saw all these prices actually posted.
And so those markets, like a technology market where there's a very, very small wedge, we know as consumers that we're going to choose to spend more money on those things, that the quality of those is going to continue to go up, and the prices are going to continue to go down. When we're surveyed about healthcare, what you read is that the majority of people in this country, significant amounts, 70 to 80%, are satisfied with their current healthcare arrangements. But when those same folks are asked if they think there needs to be reform, they say, yeah, costs need to be reformed. It's because they know we're spending more dollars on healthcare, which is true, growing portion of GDP, but it's not because of quality increases. It's not because of quantity increases, it's because of price increases. So they know there's something we can do. The healthcare wedge was caused, and you'll read about it in the study, but by beginning in the 1960s, the beginning of Medicaid and Medicare, government involvement in the market significantly created a wedge. Then in addition to that, the government regulations on health insurers that don't make insurance a true insurance market. We have examples in the paper about what true insurance markets would be. If you look at, disability insurance, or the example that we give about what if auto insurance worked like the health care market, right? We'd have no incentive to take care of our cars. We wouldn't get our oil changes. There would be no private market for oil changes. The insurers would be required to cover everything. The cost of everything would go up. We'd bring it in for major repairs, and so forth. The other thing is that we have employers standing between us and our providers of health care. 60% of us get our insurance through employer health care. So all of this causes a lot of people to stand between us and our doctors, and that's the empirical example of the wedge. A lot of studies have determined that out of a $2.4 trillion industry, about $700 billion of that is inefficiency. That doesn't mean somebody's necessarily out committing fraud. It just means there's inefficiencies in the market. So, do we need healthcare reform? Sure. But we need to have policies that diminish those things that created this wedge, not those that expand it. And an addition of $1 trillion or so in government subsidies in the market is only going to serve to expand that healthcare wedge, which will diminish our GDP, raise the cost of health inflation, raise the cost on everybody for no increase in quality, and eventually for elimination of the private market. We've estimated $1 trillion in subsidies in this study. 10 years from now will cost every American about $4,200. That's $17,000 for a family of 4, on top of what you're paying now. And jobs will be lost. GDP will be 5% lower than it would otherwise. So it's not the right solution. Whether well conceived or not, it's going to have a detrimental impact. So Congress should be focused on those things that diminish the wedge, and those things are, there's plenty of great ideas out there. I think we're about to hear some. Hopefully I'm setting you up well. And there are great ideas out here that would diminish the wedge, and they involve individual ownership of policies, bringing the patient and the provider back together, diminishing the interference. Even if government wants to subsidize low-income health care, they could do it through a voucher type of system, an income supplement system. Medical malpractice reform. I forgot to mention, even though I say it all the time, that one of the large portions and growing portions of the wedge are created by those tort decisions in defensive medicine, and allowing for equal treatment, tax treatment of individuals versus employers, so that we become better consumers. I know that when I left the government, no longer had an employer-sponsored plan, I went out and shopped, right? Went out and shopped, called all of the health insurers, and became a much better consumer. And we know intuitively those things will happen. We know that intuitively that we could do better in our healthcare markets, but we don't want to lose the system that we have, since 70% of us are satisfied with our healthcare arrangements.
Thank you.
Great.